Good afternoon, everyone. So today I'm going to be speaking to you about risk assessment and the management of periodontal disease. So the table of content follows as I'm going to be talking about what is oral health, the risk factors for periodontal disease, the balance between periodontal health and disease, what kind of the periodontal risk assessment and what kind of questionnaires we will ask the clients, as well as management for periodontal disease. Finally, I'll provide you a summary and a list of references. So what is oral health? Oral health is a fundamental component of health and physical well-being. Oral health is influenced by the individual changing experience, perception, expectation, and ability to adapt circumstances. So these are the core elements of oral health, and these are the moderating factors, and for example, disease and condition status, psychosocial function, and physiological function. When you have driving determinants, these moderating factors in addition contribute to the overall health and well-being. So what are the risk factors for periodontal disease? This can be due to hereditary, systemic disease, or medication. We can also have habits that are, for example, lack of professional care. Also, we can have the social atmosphere, and these can be like family upbringing, culture, and socioeconomic. And the periodontal pathogen that is responsible for periodontitis is the Acidinocytomycosis. So what is the balance between periodontal health and disease? When gingivitis is present and when the individual has a low susceptibility to periodontitis, gingivitis may never progress to periodontitis. So you can see the scale is almost balanced. But in terms of periodontitis, the host response increases, and that's where the disease factor is lower and health factor rises up. So they're not in balance. But what happens after is when, for example, when we have a systemic factor like smoking and we provide smoking cessation to the client, we remove a disease factor, and this causes a balance between the disease factor and the health factors. But when we have, for example, genetic risk factor, we want to increase the health factors by providing an additional self-care routine to the client. So what is the periodontal risk assessment? Basically, it's a process of identifying risk factors that increase an individual's probability of disease, which is called risk assessment. And this can be done to identifying any individuals who have an increase in risk factor for periodontal disease. And this can be smokers, non-smokers, and we do this through risk assessment questions. And this is done by using dental risk, previsor, and these are literally clinical practical tools that we can use to identify individuals who are at higher risk for periodontal disease. So previsor, again, is basically the software that clinicians use, and it provides a severity score, which is powered by personalized benefit plans for the client and provided a patient-centered treatment. So here's previsor, and this is a small video on how to use previsor. So as you can see, we can have a questionnaire going through and they're asking different levels of questions, and the software can help with detecting what's the best treatment plan for the client. Another type of software we can use is dental risk, and this is basically a real-time risk assessment for periodontitis. Finally, we want to provide any sort of periodontal assessment questionnaires. And first, we want to ask about tobacco. Basically, tobacco use is the most significant risk factor for gum disease. Then we want to ask if the client had any sort of heart attack or stroke. Any type of untreated gum disease can increase your risk factor for heart attack and stroke. Then we want to ask if the client's taking any sort of medications. Some medication cause some side effects, and these are like dilantin and calcium channel blockers, which changes your gums. We also want to ask if anybody in their family has gum disease, because there's a tendency for gum disease to develop, which can be inherited. Also, we want to know if someone's also, who's in immediate family being tested or treated for gum problems, and these are looking at spouse and children. The bacteria which causes gum disease may be spread to spouse or the family. Next, we want to look at specifically in the female category. Females, they go through different life stages at different points of life. For example, pregnancy, nursing, and osteoporosis, and this can increase their risk for gum disease at different points in their life. Also, a client who is diabetic, a gum disease is a common complication of diabetes, and any untreated gum disease makes it harder for diabetics to control their blood sugar levels. Next, we want to ask if they had any heart murmurs or artificial joints processes. So even if you have the slightest amount of gum inflammation, bacteria from the mouth can enter the bloodstream and cause a serious infection of heart muscles or artificial joints. Also, if you have gastric ulcers are caused by bacteria. So when your gums are inflamed, bacteria from the mouth can travel to the gut and cause ulcers to become active. If you have been treated for ulcers, you should make sure you are as inflammation-free as possible. Finally, we want to ask a general question to the client about their overall health, and this can be questions about if they're feeling that their gums are bleeding when they're brushing, or if they have any sort of red, swollen, tender gums, or if they have any sort of food impaction. And this provides an assessment of their oral health regime at home. Next, for management of periodontal disease, we want to go through this checklist. So first, we want to educate the clients. We want to provide motivational strategies, as well as we want to reduce the bacterial challenge. Finally, we want to provide a local delivery system for antimicrobial agents. And then we want to eliminate the local contributing factors. Next, we would look at systemic risk factor reduction. And then we will look at any sort of host modulation therapy, if periodontal surgery is needed, and finally any sort of periodontal maintenance. So what is patient education and training? So basically, we really want to educate the client, provide enough oral self-care instructions where the client is involved, and there's a collaboration between the dental hygienist and the patient. So this can be involved with toothbrushing technique, if they're using any interdental aids, or if they're using any sort of tongue cleaning devices. Finally, next we will look at if there's any sort of motivational interviewing. So basically, we want to really collaborate with the client to strengthen their own internal motivation and commitment, rather than persuading them to change their behavior. So this is very patient-centered technique. Next, we want to look at periodontal instrumentation. So the actual disturbance and removal of plaque and biofilm causes the periodontal, reestablishes the periodontal health, and restores the balance between the bacterial flora and the host immune response. So the reduction in the bacterial challenge is done through instrumentation, and as you can see in this picture. Finally, any sort of local delivery systems for antimicrobial agents can really reduce the systemic adverse effects and provide an effective drug concentration in the periodontal pockets. And this can be any sort of gelatin chip inserted into the pocket, or any antimicrobial agents that are locally expressed. And next, we want to look at any sort of eliminating any local contributing factors. And this can be, for example, if there's a local factor that increases plaque biofilm, and this is usually a clinical example of this, is the rough edge on a restoration. Also, if we have local factors that increase plaque biofilm pathogenicity, and this usually is the calculus deposits harboring plaque biofilm. Next, if we have any local factors that inflict damage to the periodontium, and usually these are ill-fitting dental appliances or traumatic toothbrushing. So we want to reduce any sort of systemic risk factor reduction, and this diagram shows any general systemic factors, And this is, for example, diabetes, cancer, metabolic syndrome. Finally, we want to provide any sort of host modulation therapy, and this is to provide a modifying the patient's defense response to help the body defense limit damage which is caused by the disease. And most likely, we use doxycycline in clinic. Finally, if periodontal surgeries may need to be, we want to eliminate the pathological changes in the pocket. So in order to provide a stability in the periodontal tissue and provide a healthy state of the periodontium throughout the life of the patient. So as you can see in this diagram, it's a flap surgery happening. Finally, we want to maintain periodontal maintenance, and this is done through really providing a medical update of their status, interviewing the client, providing a clinical assessment, evaluating the effectiveness of the patient's self-care, identifying their treatment needs, conducting a periodontal instrumentation, providing counseling, and finally, application of fluoride is needed. So in summary, basically risk assessment is to provide clinician with to help clinicians predict their clients' risk of developing periodontal disease and improving clinical decision making. This in return can help clients adhere to their self-care and oral health regimen, which is a key component to the successful periodontal disease management. And this is a list of references that I have, and thank you for listening to my presentation.